Good afternoon. Welcome, everyone. We'll just give you a few moments to join our session, and then we'll get started. Thank you so much for spending some time with us this afternoon. My name is Melissa McVie, and I am the Director of Communications with the Ontario Association of Residents' Councils, known more commonly by our acronym OARC. And today, OARC is so pleased to be hosting guests from the Ministry of Long-Term Care on our Zoom platform to provide an information session for residents. Our presenters will be sharing information and updates about respiratory illness preparedness. Before we start our session, I'd invite you to join me as we reflect on an Indigenous land acknowledgement. Together, let us now pause as we acknowledge the Indigenous peoples of all the lands that we are on today, from wherever we are virtually participating in today's meeting. Let us take a moment to acknowledge the importance of the land we each call home. We do this to affirm our commitment and responsibility to improving relationships between nations and to improving our own understanding of local Indigenous peoples and their cultures. We acknowledge the ancestral and unceded territory of all the Inuit, Métis, and First Nations people who call this nation home. Let us now join in a moment of reflection to acknowledge the harms and mistakes of the past and to consider how each of us, in our own way, can move forward in a spirit of reconciliation and collaboration. Thank you. Now, before we jump in, I have a few very brief housekeeping announcements to share so we can really get the most out of our session and our time together today. I did want to let everyone know that this session is being recorded, and a copy of the recording as well as the presentation slides will be made available following the session and will be posted on OARC's website. This information session is being offered in a listen-only mode, and we do this in an effort to really minimize or eliminate any background noises for our speakers. But we have protected the second half of our time together today for questions and answers. So we invite you to utilize the Q&A feature on your toolbar to submit your questions. We will also be incorporating some of the questions that were posed when you registered for this session. So there were a few, and we do want to prioritize questions that have come through from residents. I also wanted to let you know that we have enabled closed captioning, should you wish to utilize that feature. And now to introduce our guests. Our esteemed panel of guests today are joining us from the Ministry of Long-Term Care. We also have Gail Ramsden, a resident leader and director on OARC's board, living in Ottawa, Ontario. So welcome, Gail. Thank you for being here. And Gail will be called upon a bit later to help facilitate our question and answer period. I'd like to give a warm welcome to our first speaker, Christine Lorio, who is our Director of Service System Planning and Operational Issues in the Long-Term Care Operations Branch at the Ministry of Long-Term Care. Welcome, Christine, and thanks so much for being here.
Thank you so much, Melissa, and thank you very much for having me today, join all of you to provide a little bit of information on being prepared over the respiratory illness season. As Melissa said, my name is Christine Lorero. I'm with the Ministry of Long-Term Care, and I've been supporting the pandemic response and fall preparedness over the last couple of years. So first and foremost, thank you all for joining today to listen to our overview. We're excited to, yeah, we're excited to hear your questions and comments and have the opportunity to answer your questions. It's really important to us to be able to have this time with you and to hear your questions and concerns and be able to answer those or take away any questions or concerns. So I will start by providing an overview, a picture of this year's respiratory season. We are anticipating another challenging respiratory season with the flu, RSV, and COVID circulating, similar to last year. The risk of severe outcomes to residents due to COVID has been significantly reduced due to vaccines, antivirals, and just generally high immunity in the community. We are currently experiencing moderate levels of COVID activity in the community, while currently flu and RSV levels are low, but are projected to increase over the next couple of weeks. The ministry works really closely with the Office of the Chief Medical Officer of Health to monitor trends in the respiratory illnesses and determine whether any further action is needed to mitigate any risks and protect the health and safety of those living in, working in, and visiting long-term care homes. Next slide, please. A key way that we remain protected in long-term care homes, whether living or working or visiting, is through infection prevention and control measures. These include hand hygiene, so washing your hands before and after meals, using soap and water or hand sanitizer, wearing masks in common areas, and especially for staff when working directly with residents. So staff are required to wear masks and appropriate personal protective equipment, or what we might say PPE, if there is a risk of exposing themselves or others to an infection such as COVID-19. And residents may request at any time that staff wear a mask when providing care. Homes must also provide PPE, so personal protective equipment, for staff, residents, and essential caregivers. And lastly, on this slide, staff, caregivers, and visitors should be self-monitoring for symptoms and not attending the home if they're not feeling well. Next slide, please. Another key way that we stay protected, sorry, if you can move to slide, I think, oh, is there a slide, vaccine and therapeutics? Maybe it's the next slide. There we go. Thank you. So one of the key ways that we stay protected over the respiratory illness season is by getting your vaccines. Vaccines have really proven to be one of the best ways to stay protected and prevent severe illness and severe outcomes, including hospitalization. The recommended interval for the COVID-19 vaccine is 6 months after your last dose, or if you recently had COVID-19, 6 months after that last COVID-19 infection. But you can receive it as early as 3 months after your last COVID dose or infection. So homes should already have their COVID and flu vaccine campaigns underway, and homes are required to offer COVID and flu vaccines to residents. We do also encourage homes to consider staff and caregivers when they are planning clinics, although recognize that may not be possible for all homes. We also do strongly recommend and encourage where possible that the COVID and flu vaccines be co-administered at the same time, although it is perfectly safe and effective to do so. But it's also, some homes prefer to offer those vaccines separately, and that is also safe and effective to do it that way as well. New this year for the province of Ontario is a new vaccine for RSV. RSV tends to impact young people and seniors in terms of severe outcome, and the RSV vaccine program is targeted for residents over the age of 60. So that should be rolling out in the coming weeks. And for this vaccine, we do recommend that there be at least 2 weeks, so at least 14 days between receiving the RSV vaccine and any other vaccine. And lastly, another key way to stay protected from severe illness or outcomes is to access antivirals such as Paxlovid or Tamiflu if you have COVID or the flu. And we have encouraged homes to pre-assess residents for eligibility so that if you do become sick with COVID or flu, they can access those as quickly as possible for you. Okay, next slide, please. Outbreak management. So this is a question we receive a lot in terms of how an outbreak is declared and how a home decides what the appropriate measures are for a particular outbreak. So the home works really closely with their public health unit when they suspect an outbreak. It is the public health unit's responsibility to declare when a home is an outbreak and to declare when the outbreak is over. The home's outbreak management team works really closely with the public health unit to manage the outbreak response. And that is based on, Ministry of Health guidance, which can include cohorting residents, isolating, masking, et cetera. And we'll speak to some of those on the next couple of slides. One key piece I wanted to note is that in our regulation, we do stipulate that homes cannot deny access to essential caregivers. So caregivers are permitted to continue visiting their loved ones, to visit residents when the home is in outbreak. There may be restrictions on general visitors depending on the circumstances of the outbreak, but you will have access to your essential caregivers even during an outbreak. Next slide, please. So in terms of what some of those outbreak measures are following the Ministry of Health guidance, so there could be isolation for when residents are infected. The isolation periods can vary for different types of infections. So for COVID, according to the Ministry of Health guidance, they do recommend a 10-day period of isolation. Residents may be able to leave. You may be able to leave your room and join in activities after 5 days if your symptoms have improved, you have no fever, and you're able to wear a well-fitting mask at all times. In terms of any close contacts, so someone who is, for example, a roommate who has not yet experienced any symptoms and hasn't tested positive for COVID, the recommendation is to isolate the roommate because of the close contact, and to wear a well-fitted mask and physically distance from others as much as possible when outside of the rooms, and not to visit other areas of the home or interact with other residents who haven't been exposed. If there's no symptoms after 5 days, they can discontinue their isolation. And any other close contacts do not need to self-isolate, but should follow risk reduction measures such as wearing masks and physically distancing where that's possible. Next slide, please. Additional infection prevention and control measures during an outbreak might also include using additional PPE, such as recommending universal masking, cohorting based on exposure to COVID-19. There might be recommendations to shift from larger group activities to smaller group activities, as well as recommendations for increased cleaning. So again, the home's outbreak management team with their IPAC lead and the public health unit will determine what the best measures are based on the circumstances of the outbreak. And the ministry works really closely with the Chief Medical Officer of Health Office to review these measures and make sure that they're appropriate based on the current circumstances. I think that might be my last slide, and those were a high-level overview of the key measures in place to remain protected and prepared over the fall respiratory season. And we're happy to take and answer any questions. I am joined by a few colleagues here who are also available to answer your questions.
Thanks, Christine. Perhaps we can ask Gail Ramsden to start our question and answer period with a question that's come in from residents, and give those who are posing questions live a couple extra minutes to get those typed in. I see they're starting to trickle in. So over to you, Gail.
Great. Thank you so much, Melissa. The first question that I have is, will the ministry provide some guidelines for holiday celebrations during an outbreak, specifically leaves of absence, visiting, decorating, and celebrating? In past years, our ability to celebrate the holidays was adversely impacted by strict safety measures.
Yeah, thank you for that question, Gail. And I completely acknowledge and appreciate the importance of celebrating a number of holidays and special occasions, birthdays, anniversaries, as well as the holidays that generally come over December. I think it's really important for residents, with your residence council and your family council, to be engaging with your home about how that can be done safely while still recognizing some of the measures that might be in place, especially if a home is in outbreak, and just really working with the home to find ways to do that safely.
So there are no direct guidelines coming from the ministry with respect to curtailing activities during an outbreak specific to Christmas time.
Yeah, at this time, the ministry does not have any specific plans to communicate specifically about holiday celebrations, but that is certainly something we can take back and see if there's something that we can provide to be helpful. We do want to be able to support that as much as possible in homes, but also recognizing that homes themselves will be working with their outbreak management team and the public health unit if the home is in outbreak, and trying to find ways to navigate that.
Great, thank you very much. I'll go ahead and ask another question, if I might, at this time. This question reads, will homes be encouraged to work with their residents and family councils regarding policies related to visitors and infection prevention and control?
Yeah, so I'm going to ask my colleague Jackie Sweetenham. Okay, great, she came on camera because we do have rules around this, so Jackie will speak to those. Thank you, Jackie.
Jackie, we can't seem to hear you, Jackie. I'm not sure if you're, but I don't think you're muted. It might be a setting with the speakers.
No,
that's okay. Perhaps we could jump to another question and circle back to this one.
Sure, let's try that.
Yeah, sorry about that, Jackie.
Yeah, no problem. Do you want me to go ahead with one more?
There's one that's popped up in the Q&A, Gail. So maybe I'll take one of the audience questions because they're starting to flow through, and we'll come back to your question.
Of course.
When a home or a home neighborhood or a resident home area or unit, I know everyone has different language that they use for resident areas. If there's an area of the home that's experiencing an outbreak and residents are being isolated at that time, what are the rules around a home bringing in contractors to do work in the resident rooms or the hallways? And I'm not sure if this is a Jackie question as well, Christine, or if you're able to feel.
I can speak to it generally, but I do want to see if Jackie's audio is working. No. I don't know if you have like headphones that you can maybe try. I don't know. But I can speak to the question around if a home is in outbreak. So the general guidance, again, it will be based on the specific circumstances of the outbreak and the home itself. But generally speaking, what we call essential visitors, which could include people coming into the home to do essential work, are permitted to come to the home to do that essential work. So if there's essential maintenance, repairs, that work is permitted to continue during an outbreak. So that's kind of the general guidance. Again, the home will work closely with their outbreak management team and the public health unit to make sure residents are safe and the people that are working are safe. But yeah, generally speaking, it is permitted for what we call kind of essential visitors or essential workers to come in and do the work they need to do for essential purposes. That was a lot of essential.
That's great. Thank you. Gail, I'm just wondering if there might be another one that Christine might be able to answer.
Sure. I'm going to ask, how are homes being encouraged to communicate proactively with residents during an outbreak?
So this was also Jackie was going to speak to this, but I'm happy to step in here. So we have what's called an infection prevention and control standard. So it's a document in addition to our regulations that outlines a number of requirements for homes related to infection prevention and control. So what we call it the IPAC standard. It has several requirements related to engagement and education of residents and caregivers, including providing them with appropriate training and information related to infection prevention and control. It also includes a requirement for an ethical framework that considers ethical impacts of the IPAC program on residents. So there is a section in the IPAC standard that does set out requirements for engaging residents, staff, and caregivers, including as part of outbreak management. And it does require licensees to engage with residents and caregivers in a number of aspects related to the infection prevention and control program for the home. I don't know, Jackie, if you want to try your audio again. No.
The universe is not on our side with the technology today, but that's okay. I just thought I would also just thank you for your response, Christine. I'm not sure if Gail has any follow-ups, but I did just want to mention if homes are looking to enhance communication in this area, OARC with residents support and feedback, we work together to develop a communications tool or template that's fully customizable. So this is something that you could bring forward through a resident council meeting and initiate that conversation with home leadership to talk about how it could be tailored to meet the needs and communication preferences of residents in your home. And even just the cadence of how frequently residents want to be receiving information. So it could be used for COVID-19 outbreaks or really year-round for any kind of changes happening in the home. As residents have told us time and time again, they want to be in the know and be amongst the first to know when there are changes happening that affect them. So
yeah, thank you for adding that in, Melissa. We did include that information with our memo to homes when we provided them with resources for preparedness for the fall respiratory season. So thank you for adding that in.
Great. Thank you. Gail, back over to you.
Okay. And it builds a little bit on what you were just speaking about, Melissa. This has to do with resident councils. What can a resident council do if they feel that their home is layering on rules above and beyond the ministry and public health guidance? For example, during extending periods of isolation or restricting leave of absences for non-affected residents during an outbreak.
Thank you, Gail. This is a really important question, and this is certainly a question we receive quite a bit as well. So while homes may go, like what we set out in our documents, in our COVID guidance, are minimum requirements for homes. And while homes may go above and beyond those, they really must do that while carefully considering their obligations under the Act, which includes the Residents' Bill of Rights. And we also encourage homes to be engaging with their residence council, their family council, their public health unit when looking at implementing any measures that might go beyond the provincial requirements. Certainly when it comes to isolation periods, we know how hard that can be on residents and their family members, and we really recognize the toll that takes. So homes are expected to follow the isolation requirements related to COVID-19 as they're set out in the guidance and based on the advice from their public health units, unless there's good reason to be going above and beyond that. There's also no restrictions COVID related for residents to be able to go out on a leave of absence during an outbreak. So, if that is happening, we do encourage residents to be, speaking with their home, speaking with their residence council. And I mean, if the concern is still there, the mechanism through the ministry is we do have the action line to contact. You can contact us and file a complaint, and the ministry can investigate the circumstances of that to make sure that homes were following their obligations under the Act and related to the Residents' Bill of Rights.
I think it's Jackie. I think I've joined with sound, but I don't have anything to add to the excellent responses provided by Christine so far.
Thanks, Jackie. Thanks for your perseverance as well.
I'm so sorry.
Having you there. I just also wanted to offer yet to expand on what Christine has shared. Our ministry partners have been very responsive when there have been these kind of anomalies or instances where homes are layering on and they are brought forward either through ministry channels or if they've been brought through OARC, that there's been individualized follow-up to try to get a resolution for that resident, because we know these things can be very stressful, and so the importance is to talk about it and to kind of flag it as soon as possible so we can work through it together. Thank you so much. I'm going to ask Gail do you have another question kind of at the ready, and I'll kind of take a fresh peek at our Q&A.
Sure do. I understand that residents' councils must be consulted on an annual basis about emergency planning and preparedness. Does this include consultation around outbreak management, pandemic planning?
Jackie, I'll turn that one to you.
Thank you. And again, I'm so sorry about this, everyone. Yes, it should be understood to include consultation on outbreak preparedness as an aspect of emergency preparedness and response.
Is there a mechanism that measures whether that consultation is happening? Is that a measurable quantity? A measurable item that is reported back to the ministry?
There's the annual attestation form where the administrator is signing off, committing that has happened. But I would also imagine that it would be documented in resident council minutes and family council minutes that conversation has happened. And usually when the ministry inspectors come in, they do kind of have eyes on the minutes to look for those kind of things. But perhaps Christine or Jackie might have something to add.
Yeah, no, you got it there, Melissa. And certainly if there were a complaint made about a resident council not being engaged as part of the process, that's something that the inspections folks would kind of dig into even further. But you've kind of, I think, covered it in terms of how that might be captured and documented, and homes do have to sign an annual emergency planning attestation form and submit that to the ministry on a yearly basis.
Okay, great. Thank you.
Great. So there was a question that came in live. Will the RSV vaccine be offered to residents by the home or within the home at no cost to residents, similar to the COVID and the flu shots?
So the short answer is yes. So the Ministry of Health is working with public health units now to get the RSV vaccine supply to the public health units. And then your homes will be working with the public health units to get their supply. The RSV vaccine program does cover the vaccine for long-term care residents who are over the age of 60. For any individual in the community, so someone who's not in a long-term care home or not in an eligible retirement home, they can access the RSV vaccine, but at a cost. But it is free and will be made available to residents of long-term care homes. And oh, sorry, one last piece I wanted to say. You can probably anticipate that starting to roll out towards the mid to late November. I know homes right now are working through offering COVID and flu vaccines. So for many homes, the RSV vaccine will probably come after those campaigns have wrapped up.
Excellent. Okay, these are excellent questions. And if you haven't heard anything about vaccine rollouts at your home, it's a great opportunity for the resident council to invite a conversation with whoever might be overseeing the vaccination programs at your home, or the infection might be your infection control lead, director of care. So it's a really important opportunity to build those trusting relationships with your team, and also to have your questions answered proactively, not when someone is at your door kind of with the vaccine ready. You want to be able to feel prepared and to make an informed decision and provide your consent with all of these vaccines happening. It can be a little overwhelming with a few things running concurrently, so it's important to kind of feel supported and well informed. So there's another question that's come through in regards to vaccination, and this person was wondering if they have pre-existing conditions such as cancer. So I think it's more, would there be things that would make someone not a candidate to receive a vaccine? And I imagine this was more of a conversation that could be happening at the home level to really look at the risks and benefits and make the right decision for that individual. I see some heads, but I'm not a medical expert, so.
And I'm not a medical expert either. Yes, 100%, Melissa, strongly encourage residents to be speaking with their healthcare professionals about whether the vaccines and whether it's the COVID, the flu, or the RSV vaccine, to make sure it's right for you. And really, your healthcare professional is really in the best position to be able to answer those questions.
Great. We've got some other very specific questions coming through. And this one's a bit more generalized. Is masking being encouraged more at this time or this time of year because of the cold and flu season? And I know every home has been kind of giving different guidance based on their consultations with their public health teams and also kind of what's going on regionally. So I don't think there's necessarily a blanket recommendation at this time, but perhaps our guests could speak to this one.
Yeah, I'm happy to answer that. And this is a great question around masking, especially recognizing we had universal masking in place in long-term care homes for such a long period of time. Currently, the guidance that homes are following from the ministry includes staff wearing a mask based on what's called a point of care risk assessment. So that's an assessment of whether there's a risk of transmitting an infection between the staff and the resident, which is part of routine practices for a healthcare professional. And visitors and caregivers are strongly encouraged to wear a mask. So the ministry has been continuously assessing the right measures to have in place and what becomes like a legal requirement on homes based on the risk in the community and with the upcoming, or we're in it, the challenging respiratory season upon us. So that's something we continuously assess and take a look at to make sure we're striking that right balance between requirements and what's recommended, but would strongly encourage people to be wearing masks if they're, in crowded spaces. If there is a risk, for example, if a family member has just recently been around someone who has COVID-19 and they're coming into a long-term care home, that's a good opportunity for that person to be wearing a mask to try to reduce the risk of passing on infections within the long-term care home. So right now we strongly encourage it, but there's no universal masking requirement in place currently.
Thank you. Gail, would you like to offer another question?
I will. And this is something that I know that you touched on during your presentation, but it's something that we get confused about a lot because there's different answers depending on where you are within an outbreak situation. So the question is, can you clarify, when my home is experiencing an outbreak, that only those affected must isolate and that other residents can continue to gather and enjoy programs in connection with others? Because I'm not sure that that's what happens.
Yeah, thank you, Gail. And like you said, this is a question that does come up, and I did touch a little bit on it in the presentation. I think, so the short answer is that it really depends. It depends on the circumstances of the outbreak. And really a home will be working closely with their outbreak management team, with the advice of their IPAC lead and the public health unit to determine what the best approach is to manage the outbreak, that specific outbreak. Recognize, how many residents are impacted, how many staff, and they might be thinking about, how prevalent is COVID circulating in their community? So a lot of factors that they're going to be considering, but they are following the general guidance set out by the Ministry of Health. So I can speak to some of those pieces, again, recognizing the final decision and direction is made kind of based on the unique circumstances of an outbreak. So generally, you may recall in the past, anyone who was even a remote contact of someone with COVID, there were, significant isolation and cohorting rules in place. So that has certainly evolved over time to really try to reduce and minimize the impact, the negative impact on residents, especially around isolation. So residents who are sick with COVID-19 are generally self-isolated for 10 days. Again, I spoke a little bit about, if their symptoms are improving and they don't have a fever and they can wear a well-fitted mask, they could leave their room after 5 days, again, if their symptoms have improved. Close contacts, such as roommates, there are some isolation rules around there as well, but looking at if they don't have any symptoms after 5 days, they can discontinue isolation. But generally, other contacts do not need to self-isolate. And as for activities, that will really depend on the circumstances of the outbreak. Is the outbreak confined to a unit, or is it affecting the entire home? So those are really decisions that will be made by the home in terms of how they can safely operate the home, but while trying to minimize that the impact on the social and emotional well-being of residents. I don't know, Jackie, if you had anything else you wanted to add to that.
No, not at all, but thank you for asking.
Thanks.
I think one of the concerns in this area is going back to a question that I asked before about homes layering on additional rules above and beyond. And I think that it's not unusual for IPAC teams to be the final say in a lot of these matters. And while you're explaining that they're working in accordance with public health, there is a certain amount of fatigue versus appropriate protection. And I think that that's why there are so many questions lingering about this, because there's a lot of fatigue around this. And long-term care is now the only place that you see people wearing masks and having isolation and I think that's one of the challenges of trying to understand the rules that are in place versus the protection versus the appropriateness, on top of homes layering on. And what do you do when your individual home is layering on? I know we talked about, going to the action line, but that's not an immediate response. So I think it just goes to speak to a lot of the frustration from a resident perspective.
Yeah, I really appreciate you saying that, and I hear you. It is really tough. I think another approach that Melissa spoke to as well is if you get in touch with OARC, we can also have conversations before it kind of hits the inspections complaints level. It's hard for me to speak about specific circumstances and specific homes unless we have additional information about the specifics. So if there are specific circumstances, I think through OARC, we also have an opportunity to look into some of those individual circumstances, and then the formal mechanism, though, certainly is through the action line.
Thanks, Christine, and thanks, Gail. There's a couple questions in here that I think might be best directed to Jackie. There's some specifically about vaccines. Is the vaccine effective on both upper and lower respiratory viruses? And I suspect that's why we have maybe different vaccines targeting different types of infection, but I didn't know if you could maybe provide a little bit of clarity on that.
Sorry, I think I heard that that's directed at me. Sorry, I am not a clinician either, but and I'm also not sure which vaccine the resident would be asking about. So if it's COVID or if it's RSV, and I'm not actually sure whether RSV is an upper or lower respiratory infection, but the vaccine would be targeted toward obviously the nature of that illness. I don't know if that helps at all.
No, I think this is more, there's different vaccines that address different infections that might affect different parts of the respiratory tract. So I think having that vaccine specific education at the home level is so important so that people kind of know, because there's another kind of related question about needle fatigue. And I think this kind of speaks to touches kind of on what Gail was saying. There's just been a lot of emphasis on immunization and having the boosters and different types. And this time of year, when there's 3 different vaccine options happening, it can contribute to this fatigue. Does our ministry partners have any suggestions for kind of dealing with this vaccine or needle fatigue to convince someone that on top of their COVID booster and flu shot that RSV inoculation is necessary or recommended? And I know we don't have public health partners on the call today, but any kind of advice or guidance to support this person's question?
I'm happy to start and then, go ahead, Jack.
Yeah. No, I was just going to add, RSV is typically an upper respiratory infection. So the vaccine would be targeted to RSV specifically, which is typically an upper respiratory infection. Sorry, I should have added that. I don't know if that helps at all. But go ahead, Christine.
Okay. Yeah, in terms of vaccine hesitancy, vaccine fatigue, I think we're hearing this across the general public. I wouldn't say that these feelings are unique to residents in long-term care homes, but it is really important because based on the different illnesses, many residents in long-term care homes are more at risk of having severe illness from COVID, flu, or RSV. One of the things we're still, waiting to hear more about on the RSV vaccine is whether that becomes an annual vaccine, or what we're actually starting to see through the studies that were published that led to it being approved, is that it might be one that actually has a longer duration. So it might be one that's only needed every 2 years, for example. So we're still like more direction and information will come on that. But I think really it's about the risk to yourself in terms of potentially becoming very seriously ill from flu, COVID, or RSV. There are individual vaccines that help protect against some of the severe risks associated with each of those. And currently they are 3 separate vaccines, unfortunately. So it would be, 3 separate times, getting a needle. I have my appointment booked for Monday. I don't qualify for the RSV one, but I am getting the flu and COVID together on Monday. And I've even encouraging, my parents, my friends. One of the things I hear, oh, well, I got COVID last year and I didn't get very ill. Why do I need to get a vaccine this year? And I'm like, well, probably in part you weren't that ill because you did get the vaccine. So I think reminding people that the vaccine has really helped reduce the really serious effects of COVID that we all experienced in those first few waves. I think is a good reminder for how important it is to get vaccinated.
Thank you. Gail, do you have another question? Okay.
I do.
We're nearing the end of the questions in the Q&A. So I'm not sure how many you've got left, but we'll maybe give you an opportunity.
Okay. All right. What resources are available to support resident mental health and well-being and lessen the impact of loneliness during extended periods of outbreak?
Now, this is a really tough one. I can only imagine how challenging it has been for residents when you're, being self-isolated, or your activities have been paused. Really encourage you to work with your home and your residence council to see what opportunities there are to continue, whether it's virtual activities. So maybe some homes or residents have access to iPads, as an example, and can communicate with loved ones using technology, or maybe there's games that can be done using technology. So I think technology is certainly one option. It definitely does not replace face-to-face contact. One piece I forgot to mention earlier as well is if residents are isolated because they're if they have an active COVID-19 infection, they are permitted to, leave the room for short walks and try to get some fresh air, or just a walk in the hallway with, a staff person who has the right protective equipment, just to, help, mitigate some of the negative impact of being in a room for so long. So, just a couple of things there that I flagged, but really encourage residents to work with their home to find opportunities to make sure residents are engaged and really reduce that negative impact of those periods of time when activities might be paused, or they're having to spend extended periods of time in your room if there's an outbreak. I know, Melissa, if you had anything else from your perspective to add on that.
We did hear homes using some very creative solutions, and even, residents wearing PPE to do, doorway visits. It really depends again on the severity of the situation and the guidance from public health. I realize there's, a lot of moving parts. So we can't give blanket guidance, but I know there were investments from ministry as well to invest in increasing mental health supports at the home level as well. And so some homes did use an opportunity to increase social service work and other things. So it's we have to keep this conversation going. This has certainly been one of the areas that I think we heard about and our ministry partners heard about loud and clear, that the adverse impact of prolonged isolation. And so I think that's why there were changes to the legislation so that essential care partners could still be visiting and things like that were really missing in the first earlier waves. And as Christina said, the situation is evolving and we are continuing to learn and trying to balance the risk with quality of life. So I don't think I fully answered your question, Gail, but thank you for posing that one. It's a very important one. There's a question about communication that's come through the Q&A, and it's communication about, or how does the public health unit communicate with homes when community rates, infection rates increase, and how would they suggest homes to be proactive and maybe increase masking and other protections? So I think there is a designated IPAC lead in every home, of course, and then there would be someone from public health kind of appointed to have that ongoing conversation with the homes, but I'm not sure how the information really flows.
Yeah, there are, I think it's 34 public health units across the province. Each will have their own specific kind of communication mechanisms or protocols in place. What we do know is most public health units engaged their long-term care homes over the summer in kind of fall readiness type of activities. So talking through with the home, do you know, like, who you need to contact if there's an outbreak, do you have the right PPE? So kind of doing all that good preparedness work. And public health units are in regular contact with their long-term care homes in their area, talking about these kind of things. And certainly if there's an outbreak, that would enhance the communication between the home and the public health unit to be talking about how to manage that particular outbreak and the context of what's happening in their community. The only other piece I would add to that is that a number of public health units have really good websites that also include good information on what's happening at the community level, where you can see how many outbreaks are happening in different settings. So it might be long-term care, retirement homes, other congregate care type settings, as well as general indicators on community level COVID activity or flu activity. So there's some good information on their websites as well that homes might be tapping into.
Thank you. And I know that the public health teams are used to communicating with clinicians or kind of more clinical team members in the home. And so residents aren't necessarily their audience. So that's, again, where having a customized communication tool or strategy where this information can and must be communicated to residents in an accessible, timely manner. Like, that's where resident councils can be real champions to get this going, and working in partnership with your home leadership team. So as these community updates are unfolding, I think it's just finding that balance, because I know we don't want to scare people by saying, oh, there's infections, in the community, but if residents are likely to hear about it through other news sources or word of mouth from team members who live in the community. So it's important that residents are made aware on that ongoing basis. And so what's going to work for you and your home might be different than the other home in your town, but it's important to kind of get that going. And it might be some trial and error, but residents are the experts about how they want to receive information. And it likely is going to be different for different residents within the home. So it's probably a bigger strategy on how to get the word out. So Gail, did you have any other thoughts on how to communicate? Or
no, but I have one last question that probably might be slightly out of scope for this presentation, but I'm going to ask it anyway because it might be something that's in the minds of people who are taking part in the webinar. So the question is, mental wellness in long-term care is more than just coping during outbreak. or pandemic IPAC situations. So what are some techniques or ways to stay mentally healthy on a daily basis?
I think that's a really excellent question, Gail, and certainly the ministry not only wants to be thinking about how we support quality care in long-term care homes, but also how we're supporting quality of life. I'm not sure if I am the best person to be answering that question, but I think it's a great question. I'm not sure if any of my other ministry colleagues want to speak to any particular techniques, but I know Melissa spoke to the resident health and well-being program or funding that has been provided to homes to help with some of that. So it might be supporting additional therapeutic recreational opportunities, social workers, and those types of supports in homes. But I'm happy to kind of take the question away, because I do know there are parts of the ministry that are actively looking at how we can help support improved quality of life overall. Completely appreciate your point. It's not just about how we're coping during outbreaks, but how can the ministry be working with homes to better support overall well-being is really important to the ministry.
Yeah, I appreciate you saying that, and I appreciate that this presentation is on outbreaks and IPAC controls, but mental health is a daily thing, and kind of revolves around 365 days and not just 10 days of an outbreak. So it becomes paramount in it being something to focus on going forward, be it additional funding for additional recreation staff or specific recreation funding. That would be a really big step forward. Thank you for your reply.
Thanks, Gail. And I certainly wanted to also share the power of peer support. We've witnessed this firsthand happening within homes, but also across the province through OARC hosts a weekly resident forum. So it's a great way to kind of check in with other residents living in long-term care homes across the province. We offer just using the Zoom platform, like the way we're meeting today. Residents can tune in every Thursday at 2 o'clock. Gail's one of our fabulous resident facilitators. So it is peer-to-peer. And there's OARC team members kind of supporting in the background, but it's a great way to kind of hear how other people are kind of coping, things that are working well, what are some of the challenges, so you can kind of work through together. We're not counselors or mental health experts by any means. We've had very positive feedback that having kind of a weekly connection or feeling like you're in it together with other people can also be a source of comfort and support. So I would encourage residents on the line, or maybe resident supporters on the line, to kind of share this opportunity. People can phone in or they can join on camera, and that is a weekly option. We've also run these once a month for resident council assistants too. So that's another great way to kind of hear how other team members are kind of problem solving and staying abreast of promising practices and that kind of thing. So we at OARC really try to provide that network of support. And behind the scenes, we are also meeting on a regular basis with our ministry partners so that we can bring themes and feedback to our ministry partners who are involved in policy making and operational planning and that kind of thing. So it's so important that we just keep talking about it so we can work through some solutions together. So we are at that 3 o'clock time in our afternoon. That hour has really flown by. I didn't know if we were going to need the full hour, but it certainly was time very well spent. And I know we perhaps didn't cover everything. The scope of our webinar was quite specific to respiratory illness preparedness. So if there's some follow-up questions or perhaps other areas of interest that you would like OARC to tackle in terms of future webinars or collaborations with ministry, please take a moment to fill out the post-webinar evaluation so we can capture those and follow up. And just a reminder that we have recorded our session today, and we'll be sharing the presentation and the slides following our time. So thank you so much to Christine, Jackie, and ministry guests for being here with us today and for your responses, your thorough responses. Also, a huge thank you to Gail, who helped to kind of collate and pull together all the resident questions that came in through registration, and for my team members helping behind the scenes to make sure we answered all the questions that came through. So thank you. Stay well, everyone, and stay in touch. Okay.
Thanks, everyone.
Take good care. Okay. Thank you.